So when we look at the tritis symptoms, we can see that pain may interfere with your exercise. It can affect your psyche and emotions. We recommend to set up the goals and not the pain, but respect the level of pain. When we talk about fatigue, we're on the next slide here. Your performance during exercise is often dependent upon how you're feeling. Exercise on good days, rest on bad days. Modify the exercise to match your energy level. Those are some guidelines. And then as far as disturbed sleep, you should exercise with caution if you're sleep deprived. Be careful when exercising with medication. Certain meds can mask symptoms, but can also affect your performance due to the side effects. Okay, those are kind of the things. So let's talk about the three different types of clients that we see in our clinic. When we talk about the fibromyalgia client, we're talking about the very difficulty exercise client. Those are the ones that get referred to me especially, where their symptoms may limit physical activity beyond normal daily activities. They're just barely making it. That's kind of like my mom right now. She's just kind of, that's it. She'll peak out and she's done. And so what I'm trying to do is I'm trying to cycle her exercise and her medications. Okay, she has a low level antidepressant. Okay, it's not one of like Zola. It's not one of the stronger ones. It's just a simple one where I talked to the doctor and he's like, yeah, you can try it. So it's just a trial. When we talk about suggestions, individuals may need to deal with their post-exercise symptoms. That's a key thing, is that if you're just starting an exercise program, you could be high level with walking and with weight training, but if you decide to start yoga or Pilates, you're automatically a newbie. Does that make sense? Mm-hmm. Okay, so with every new exercise, you're starting at ground zero, and then you have to test your body. Then once you start mastering it, you start getting there. A lot of people think, oh, I walk, I do a little bit of weights, and I'm going to try some yoga, and you jump into a regular mat yoga class with 30 other people in there, you're going to be rolling, you're going to be crawling out of there. Does that make sense? Mm-hmm. So I think it's so important that with every new exercise you do, you start off as like a low-level type. Consider yourself very difficult, and you're trying to gauge yourself. Gauge the intensity. How did you feel after you did 20 minutes of yoga? Okay, I can handle it. Okay, good. Maybe in 2 weeks you try 30 minutes, and then you start building yourself up a little bit. Okay, that could be one possibility. And then obviously it'll take time to learn how you exercise with fibromyalgia, and also too, this is another big thing, is trying to find the best setting for yourself. A lot of these big box gyms don't make people feel good. Mm-hmm. Does everyone agree?
Oh yeah.
Yeah.
You know, with the meathead next to you screaming and lifting weights, and all that. So think about the setting, because that's going to influence your exercises. And here's what I recommend for somebody who's really kind of not feeling good, is barely doing things, is aerobic, aquatic, and Tai Chi. I think those what we recommend are the best exercises for somebody who has difficulty exercising. Precautions include resistance, combined, and high intensity, obviously. Let's go to the next one. Moderate level. We can see that moderate level, a lot of you guys seem like you kind of fall into that category where you're actually exercising, you're handling it. You may use medications to help control your symptoms. Okay, you may use that. And a lot of times you're learning how to deal with your post-exercise symptoms. Okay, you're starting to deal with it. You may participate in pain-free activity, but you need to be a little bit more cautious when you're starting the new activities, because you might have a false sense of confidence. Oh, I feel good now. Okay, I can do this. And then you do something new and you get sore, and all of a sudden you get scared again. Okay, we have that all the time in the clinic. Someone's tried something new, they come back sore and they're freaking out. Oh my God, I'm hurt. No, you're fine. You just had a flare-up. How long did the flare-up last? Oh, I was sore for 3 days. Okay. What did you do? Well, I did three extra sets of this. Okay, you can't do that. You can only do one. And we go back. So you have to kind of stagger it a little bit. And so the best exercises are pretty much everything except for all the high intensity stuff. That makes sense? And then if you're higher level, obviously, if you're higher level, we kind of consider that weekly exercise. And sometimes people may cycle their medications. And most of the time people people who are exercising weekly can handle the exercise weekly. But some days they'll go through a period where the symptoms, for some reason, and I don't know if you guys have this, it's almost seasonal, because it's linked to allergies and stuff. There might be a couple months where they actually feel good, and then they start ramping up everything. They're busier throughout the day. They're doing a lot more social stuff. They're exercising. Then all of a sudden, when they hit, whatever their relapse is that it hits, wipes them out worse than what they had 3 months ago. So with the higher level people, we're trying to tell them, still stay on alert. We always say that. Stay on alert, don't go crazy, because you're feeling good for these couple months. Don't have a false sense that it's, it's gone or whatever. And people jump into things. Have you done that?
No, of course.
Yes.
Many
Yeah. Yeah, exactly. So that's the weekly thing, and so that's what we're kind of at.